Hi, my name is David Hirsh, and I am a clinical cardiac electrophysiologist, and I will be working at the Harbin Clinic. I grew up in Chicago, and I went to college in Ohio, and I did all of my medical education and training in New York City. I trained as a clinical cardiac electrophysiologist, so I began by training in internal medicine, and after which general cardiology, and then after that I trained to become a cardiac electrophysiologist. So it was quite a long time, about 9 years. My earliest exposure to medicine was accompanying my father on sales calls to various hospitals around Chicago. My father was in medical sales. I was enamored of these environments. I remember one in particular had a museum in the hospital where they had Civil War surgical instruments. I instantly found it fascinating. I chose cardiology because it integrated a lot of the areas of science and engineering that I found really interesting, and it allowed me to continue to use the vast breadth of my internal medicine training. And I chose electrophysiology for a number of reasons. One was electrophysiologists had to be both surgeons and internists. They had to be cardiologists and heart surgeons in a sense. And there were very few things that I had encountered in medicine where someone was responsible to have all of those skills. And I also thought it was extremely difficult. It seemed to be an area of practice where people shied away from because they found it overwhelming, and that attracted me to it. I am happiest when I treat something simply and a patient gets a good result. So when the simplest, safest, almost most ordinary intervention leads to a great result, I'm most pleased. I try to approach each patient and medical problem as though I were treating a member of my family. And I think in general, my approach to my family is, let's begin by trying the things that we know work to treat a problem that are the safest intervention. And we can become more invasive or more aggressive as the need may reveal itself. I want patients to feel like I listened to what they were saying and that we are part of a cooperative enterprise to treat whatever it is that's bothering them. And that what I'm telling them is the truth. It's not veiled in any way. It's not meant to distract them or confuse them, but it's also not meant not to give them a sense of false hope that things which may not be entirely fixable, maybe they're only partially fixable, that they're anything other than that they should go forward knowing exactly what the process entails and what their reasonable expectations can be. The thing that excites me the most so far is the people I've gotten to know and began to work with are quite possibly the nicest people I have ever met in my entire life. I've lived in many parts of the country, both for school and growing up, and I have never encountered more helpful, more genuinely friendly individuals in my life than I have in the last few months.